Namaskar, greetings to you all. At the outset, I thank and congratulate the Geriatric Society of India, West Bengal chapter for taking this initiation of training the nurses in geriatric care. I also congratulate all the students who are participating in this program. I bring greetings to you from BLDEA's Shri B.M. Patil Medical College Hospital and Research Center, where we started geriatric clinic in the year 2007, and thereafter we have a dementia clinic, we have immunization clinic for senior citizens, and we have now postgraduate students MD in geriatric medicine. So what we are going to discuss in next 30 minutes is how to take a history in an older person who comes to our hospital or a clinic or who is admitted in the hospital wards. The nurses have a bigger role and of course full of challenges when you deal with an older person in your hospital. So in next 30 minutes, I shall be discussing about history taking, which is a very, very important aspect in patient care. So apart from history taking, how best we can do have a communication skills with the older people, that we will discuss, and of course a take-home message for all of you. So ultimately our goal is adding life to years in an older person when years cannot be added to life. So this is a very important concept through which we are going through the field of geriatric care, and now I am happy that you are all part of this unique program where you will be trained and start taking care of older people in a different perspectives. Your approach, your attitude should change by the time you finish this course and start practicing. So as a nursing staff, you will be called or you will be posted in an IPD scenario or OPD, emergency department. You have to do a home visit, pre-operative assessment. You will be having assisting your faculty, and of course now role of telemedicine is increasing. So you as a nurse will be called in any one of this situation. So ultimately, how you approach an old man, how you comfort him, and how you help him to overcome his health issues, all should have a common aim that we should improve a quality of life in the older person. So what we can do? So whenever we provide a care for the older person, maybe it an OPD or IPD setup, our goals should be to identify the core problem. What is the problem that he is having, which is bothering him most? Be a part of solution. Never try to be should say I don't know. So try to be a part of solution. Even if you can help him prevent a fall in the hospital, it is a challenge and it is appreciated by the older people. Always try to prevent a disability or dependency in the older person. This is a very bigger role where a whole team can play an important role. And always we should provide a dignified death to the older person. The nursing care should be so effective that even the person who is in coma or he's going to live his life very few hours, he should look as fresh as he was. Okay, so nursing care has a paramount importance in providing a dignified death to the older persons. So health assessment, you have a role as a nurse that you will be assisting physicians with physical examination and procedures, which we are all doing. And now when an old man comes, just help him, give a helping hand to make him sit on the chair, comfortable on the chair. And if room is very cool, keep it warm. Or if he's feeling chills, just put on sheets or linen on his body so that he'll feel comfortable. And such things, nursing aspects you are already doing. But when an old man comes, you should be little extra cautious to provide these things. And you have to be aware of the geriatric health problems such as mental declines, incontinence, falls, and changes to the sleep pattern. Now, an old man, when he's admitted in the hospital, on the day of the admission, he may have less sleep because he is not used to the cot that he was sleeping, or the surrounding which we hospital is different from which in his home where he was sleeping for last 20 years, 30 years. So these will environment will change and may lead to sleep disturbance. So that is how you should think in an old man. And assess patient's ability to perform daily routine tasks, whether he is able to go to the toilet or the restroom on his own or not, or can he get up and sit on the chair or not. All these things you have to assess when you are providing care to the older person. And monitor patients daily to ensure that care plans remain appropriate to patient needs. Just because somebody has written the orders or this has to be done at that time, don't enforce it on the patients. For example, if patient is sleeping in the 2 o'clock in the afternoon and you have been given instructions that record blood pressure at 2 o'clock, you can postpone it for an half an hour and don't disturb the patient from the sleep. Such small things in providing care will help the older person to have a better care and outcome as well. So in your practice as a nurse, when an old man comes to you, he can be anywhere between 60 to 100 years of age. So he can come to you with atypical symptoms. He will be taking multiple drugs. Apart from allopathic, he'll be taking Ayurvedic, homeopathic, and so many other drugs, on-the-counter drugs. So he will have infectious disease. He can have a non-communicable disease like diabetes, hypertension, stroke, all those things. Or he may come in the surgery ward for major surgery or the minor surgical cases. He may admit with an iatrogenic diseases, basically the drug-induced diseases. He may admit to the cancer, or there are certain diseases which are meant in the old age, like prostate hypertrophy, Alzheimer's, malignancies. So all these are common in the older persons. Depression and loneliness is very common in the older person, which you should not ignore. You must give some time, think from this angle that am I dealing this, why this old man is behaving negatively. Maybe he is either in depression or he is feeling lonely. As a care provider, you must know what are the care modalities like palliative care, rehabilitation, hospice care, day care, and all those cares which old man can be provided. Elder abuse is one of the burning issue. It is on the nursing staff where the older person can find what the family members are doing, what domestic issues he is facing. He will tell only to the nurse rather than the doctor. Patients will be taking alternative medicines, that you have to know what all he is taking. Bereavement is very common. Nowadays, the older person lose the wife or the wife lose the husband and there are no children for them. So the responsibility again remains on us, our team, to provide a supportive treatment when they lose their loved ones. Physiotherapy or aids, we should know what aids we can help. Even if patient is having giddiness or he had already a fall, try to know at least you can prevent a fall by helping him to use a stick or a walker. All those things can be done by a nursing in a setup for elderly care. There is an entity called advanced directives, wherein some older people will keep telling you that if I become serious, don't put me on ventilator, or I don't want dialysis to be done. Such advanced directives, when the older person tells you, you should convey it to your superiors and their family members so that it will become an official document. And very most important person in providing older care is a caregiver or a family member. Of course, by default, we are all caregivers, but the family member is most important person. He decides what to do and what not to do. Okay, so whatever decision has to be taken on older person, please discuss with the family members, then go ahead with what care to be provided. Now, coming to the disease pattern, this you should know because in history it is very important. There are certain diseases which starts at the age of 40 or 50, like diabetes, for example. And at the age of 60 or 65, they will come with complications like blindness or renal failure or a heart attack. So all these things are complications of the disease which they have 25 years back, but at the age of 65. So in elderly population, you will get the patients with complications of the disease. And there are certain diseases which are new diseases at a age, like I told you, prostate hypertrophy, cataract, malignancy, Alzheimer's disease. Okay, and on average, An elderly person will have more than 3 diseases like diabetes, hypertension, ischemic heart disease, diabetes, hypertension, and cancer, ischemic heart disease, stroke, and osteoarthritis of the knee in multiple combinations. So you have to be very careful in elderly population because they will be having multiple comorbidities. Not a one disease, they will have multiple diseases in a given patient. So whenever they have a disease, the decline is very rapid while recovery is very slow. This is the very important aspect all nursing staff must know, that when an old person has developed a diseases, it may be an acute viral fever or a pneumonia, or he has undergone a surgery, the decline of the function is very rapid, whereas recovery is very slow. This is very, very important. And most of the older people, they keep blaming on the age. If he had a giddiness today, he said, "Hi, I'm getting old. I'm bound to fall. I'm bound to have giddy." So if they complain of I'm not able to eat or I don't feel like eating, so he blames it on the age. I'm now 80 years. What do you think I should eat so much like that? But that is not an solution. Always remember, aging is not a disease. It is a physiological process. Okay. So as a nursing staff or the physician, we look the older person from 4 angles. The health is looked at from the 4 angles. One is physical, mental, social, and spiritual aspect. If any one of this is damaged or affected, that leads to a disease process. Sorry. So always give importance to mental, social, spiritual, and physical aspect of the health in the older persons. Now, an old lady comes to you. Okay, I'm just giving a case scenario. She will be having multiple problems concerned to health, like a physical health, then a mental health. She may be anxious, or she may be in depression, loneliness. Then socially, she may be well supported or may not be well supported. She may be having a disability or different label like blindness or deafness, right? And ultimately a poor quality of life. So it's our responsibility to treat these multiple problems with multiple dimensional approach. We need a doctor, we need a nurse, we need a social worker, we need a caregiver. Government policies, of course, are there to help, and NGOs. All these together will help this old lady to overcome her not only a mental health, physical health, also social health. So it is our responsibility whenever we look an old person, we look from the 4 angles: physical, mental, social, and spiritual. And if they all dot together, then only they can have a good life. That improves their quality of life. So what is the challenge in this? Challenge is all these things should be provided in one person. If a middle-aged person comes to you at hospital, 40 years old, if it's come with chest pain, you make a diagnosis, treat him and send him. But in the old person, it is not same. We have to look from many angles, and we have to ensure that he has a good coordinated care from our team. So when do you approach an old man in your clinic? Always try to greet them, say namaste or good morning, or even you can shake their hands when they come to your clinic or admitted in the hospital when you are going to provide nursing care the next day. Have patience. This is a very important aspect. In geriatric practice, you need to have patience. You have to wait to get the response. You have to have time. You cannot say that, old man, you swallow the tablet, I have to go to and see another patient. No, it will take some time for him to understand which pill you are giving. He has to swallow, drink water, he swallows. A lot of things are there. It's a slow process. You need to have time. Repetition is very common. The old man keeps telling the same things every time you come. So he tells that I have a pain abdomen, I have a chest pain, I have got headache. Again, after 2 minutes or 5 minutes, still you are there, you are recording blood pressure, you are recording temperature. Again, he will tell, I got a pain abdomen, I got a chest pain, I got a headache. Again, while you are going, after giving all the pain abdomen, you understood, no, like this they ask. So repetitions of the symptoms is very common, and which we should be start getting used to it. Okay, and there are some apprehensions. The moment a doctor comes, a nursing staff comes with a crash cart or a tray, then he will feel, oh, are you going to prick me? Are you going to inject me? Are you going to create pain for me? Some apprehensions are there. So always try to tell them that I am not going to harm you, or I'm not going to cause any pain for you. I just came to record your temperature. We came to record your blood pressure, so then they'll come and they can cooperate. Always try to provide comfort. If they want to get up from the bed, give a support. If they want to sit, help them to sit, hold their hand and sit. Always try to provide a comfort in their own room, in their own chamber of the room admitted on the OPD. Always have a smile. Okay, that is what the older people expect from the nursing staff. Okay, so it should not be an artificial smile. It should come from the bottom of your heart. And maintain good hygiene. You should also take care that nurses should not have a long nails, okay, polished nails, because they will hurt the patient when you are providing care. And appropriate use of hygienic measures like a cap or a gloves, and the use of all sanitizers wherever required. So all that is maintained for not only from your side, but for also for the patients, maintaining clean linen, clean bed sheets, clean pillow covers. Even if the drop of blood has spilled over the bed, yet that should be changed immediately. And whenever your duty is over and you're going back, or the patient is living back in the OPD, at least say goodbye to him and come back so that we can have a good conversation. In history, again, it is very important for you to ask the person which activity you have stopped recently. So this will help you to know what is the severity of the disease. Suppose the patient was going for a walk every day for 5 kilometers and he said, no, I'm not going for a walk anymore. Then there is a serious issue because he is not able to walk. Okay, which symptom is bothering you most? Unless you don't ask, they will not answer. So most of the percent is constipation. Sir, I'm not able to pass stools every day. I struggle a lot to pass stools. Constipation is the biggest problem. So it is again the nursing staff. You have to ask them which is symptom that is bothering most, so that you can inform to your superiors and get it treated. Always look for the disabilities. If the person is short of hearing or vision is less, and if he's already using these aids like spectacles and hearing aids, put it in action first. Let the patient wear the specs. Let the patient wears the audio visual hearing aids. And even if he has dentures, he should use dentures before. Otherwise, you will not understand what he's talking. So when you talk to the old person, the history is of 3 types. One, he will tell you in the presence of all these family members. And second, the daughter-in-law or the son who has brought the patient, they will tell their own version of the history. And the third important history, the old man tells you when he is alone. When none of his family members are there, he will tell actually the real story. Now, morning you must have asked why you are not having breakfast, why you are so late. Okay, then he may not have answered at that time because son, daughter-in-law will be there. But again, when you go at 12 o'clock in the afternoon, and he will tell, see, you morning you asked me, why I came late, why I'm having breakfast late, because my daughter-in-law gives me breakfast at 11 every day at 11 o'clock. She never gives me breakfast at 8 o'clock because I have to take tablets for diabetes. But my breakfast starts at 11. So these are the issues. The patients will have 3 types of histories. One, when it's the family members. One, when he is alone. Okay, like that you have to have that knowledge. And always remember, past history is longer than present history. They had seen n number of hospitals, n number of nurses, doctors, and he has met plenty of diseases over a period of 20, 30 years. And his past history will be longer than the present history. Now, comorbidities. You should also make a note of history like easy suffering from diabetes, hypertension, stroke, chronic obstructive pulmonary disease, ischemic heart disease, depression, Parkinson's, cancer, heart failure, anemia, just to name a few, so that you can know what type of patient you are dealing with. And I told you, most of the older people will have 3 of this combination, 3 of these combinations in a given patient. Then you must ask for falls. Had you fall in the past? This is very important because they try to hide. They never tell in front of his son because they will restrict his activities. They will tell to you. Incontinence, they are ashamed. Older people feel ashamed that the urine leaks, the fecal leaks. So most of the older women, they have incontinence, means leakage of urine. Whenever they cough, whenever they laugh, there is 1 or 2 drops of urine leaks. So they feel ashamed to tell, but that you have to ask. Look for the pressure source. When the patient is brought to the hospital, it is mandatorily for the doctor and the nurse to look whether the patient has a developed bed sores already or not, because the patient may be have been bedridden for 2 or 3 days in the home or 1 week in the home. Then he is brought to the hospital, and if we fail to see the bed sore are there or not, and the next 2 or 3 days it may go for sepsis, and he may be developing fever. So all these things, it is also a responsibility of nursing staff to look for the bed sores. Next is delirium. Delirium is acute confusional state. Okay, so nurses will go talk to him. He will not be understanding what you're talking. He just say yes, and he'll send you. You think that he has understood. Again, afternoon when you go, then you tell him, why didn't you take this tablet? He will tell you, wait, when you have come, you never came to meet me. Then you will tell, morning I had come. So in morning he was in the state of acute confusion state. Maybe there are many reasons, but again, evening or afternoon or next day, he will be all right. So that is how you have to try to understand what is delirium in the hospital basis, and immobility, whether this old man is mobile or he requires support, can he move on his own or not. All these things you have to assess in the ask for the patient. Now you should also know the history of medicines, whether which all medicines they are taking, allopathic medicine, on the counter drugs, Ayurvedic medicine, and sometimes the older people are fond of taking medicines which are meant for others. So their friends, they share that you take this tablet, this is good for a joint pain, this tablet is good for a constipation. They keep taking which medicines are meant for the others also. So again, history of constipation and pain in knee joint, all of you must ask in all the patients, because they don't tell. They think that it is a part of old age. Constipation is a part of old age. Pain in knee joints is a part of old age. So you should ask and ensure that their bowels are clear. And if he is having pain in the knee joints, you can arrange a commode style toilet for them in your hospital or in OPD, so that can improve their facilities to have an stool evacuation in the proper way. Now, history of vaccines. The older persons in geriatric practice, we give, of course, COVID-19 vaccine. All of you know about that. Influenza vaccine once in a year. Pneumococcal vaccine once in 5 years. Hepatitis B 3 doses. Tdap once in every 10 years. And varicella vaccine once in a year after 60 years. So all these vaccines are there for older people, and you must know whether this old person is immunized or not. Then coming to the most important aspect of healthcare in older people is mental health. If he is mentally well, then all our treatment modalities will be successful. If he is not well, then there is a problem. So you have to put extra effort to ensure that he gets the treatment for all the diseases. So depression, loneliness, and suicidal ideas are very, very common. So, but once they come to the hospital and they get known to you, and they'll start sharing their problems, and they feel good that somebody is there to listen. Okay, so that is very, very important aspect. So you should always have patience when you deal with an older person. They have a lot many things to tell, which they cannot tell to you and their family members. Okay, then ask for activity of daily living, like is he able to eat on his own or he requires support? Can he have bath on his own? Can he dress on his own or not, or require support? Transferring from bed to the table or table to the restroom, and toileting, can he go on his own or he requires support? Because this is where your role is very important. So you have to know that when this patient may likely to call you that he wants to go to restroom, so he will be waiting for you, that sister should hold his hand and take him to a restroom and come back, or he needs a wheelchair. So again, it is your responsibility to ensure that old man gets a wheelchair for transfer. Then there is an entity called IADL, Instrumental Activity of Daily Living. You must know whether the old man, before getting admitted or coming to our hospital, what all he was doing. Was he able to go to the shopping, bank work, or how did he come to the hospital by bus or an auto rickshaw? Can he manage his own medicines, daily intake, or he is forgetting sometimes? Can he manage his money or getting outside with pets and all? So is it possible for him? So if any one of this is wrong or it is not doing, then there is a health issue in him. Okay, now coming to the most important aspect, communication. So all our treatment and the outcome depends upon how best communication you do. So get person's attention before speaking. When you're talking to the old man, tell him that I'm talking to you, please listen to me. Always ensure that the old man is using glasses or the hearing aids when you are talking to him. Put it in use and then start talking. Otherwise, it will remain futile, your efforts. Face the person while talking. This is very important. Nowadays, at least the masks have gone. So that is again the good thing. So that we can face the person when he's talking. This is important because the person can read your lips. He can understand what you're talking. So by just reading your lips, this is very important, natural way of understanding spoken but unheard words for the human being. Speak clearly, do not shout. Very speak clearly, short sentences. Don't shout. Somebody tells your nursing staff, a colleague will tell, oh, that person is short of hearing. Just don't go and shout in front of him. Short, talk loudly, but short sentences you do. Use sometimes cues and gestures, like ask him, what about this? He'll tell, no, urine is good. I'm passing urine correctly. Like that, you have to use small gestures so that you will get the answers. And most important thing, older people look for privacy. They want some private time in their room or their life. Okay, so always don't be bombarded with the room, with the people, and whenever you go, you knock the door and go, and in their private rooms, if they are there, even if their curtains are put in ICU and all, just ask them, can I come in and all, and give some private time for them to allow themselves to talk and share some time with them, their life. So 30 seconds. Okay, sometimes it takes 30 seconds to get an answer from the old person. That much patience you should have to get an answer. When you talk to the old person, aisa nahi ki you'll get the answers patapat. No, you have to wait. In those who are cognitively declined, those who are having depression, those who are very old, sometimes they take some at least 30 seconds to get answer for your question. So this, in geriatric practice, you need to have patience. You need to at least wait for 30 seconds to get answer for some questions. Okay, that's very important. So as a nurse, what else you can ask for the older person every day? You can, the nursing chart, apart from your doctor's orders, you can ask for the sleep. Did he had a good sleep? And if he has not, doesn't have, look for the causes. Bowels, is he passed stools or not? There is a constipation. Bladder, how many times he has woken up for answering the nature's call in the night, that you should ask. Appetite, is it improving or not? That again tells you the condition. And activities of daily living. Easy, could he move on his own from the bed to the toilet today, or from him bed to the chair, or he could have good breakfast. So all these markers, 5 things. If a patient has slept well, he had a good food in the night, there was no wake up for the bladder urine in the night, he has passed stools correctly in the morning, and he could move on his own today in the room, itself tells that he is improving. He is improving in the hospital. And if any one of this is wrong, then there is a serious issue in the health issue in the older person. Then when you are looking for pulse, blood pressure, respiratory temperature, which you already know how to record, and you will be part of doing it in the older persons admitted or in the OPD basis. 2 more things you must look for. One is the pain, and second is confusion. Is the patient is having any pain which he may not be able to tell you? He may be making some very vague expressions of the face. Or second is confusional state. Is he in the state of confusion? These 2 things are added vital signs in the older persons. Then as a nursing staff, you have to record weight of the older persons. Every month he visits to your hospital. So if he is losing the weight or gaining, that you have to assess. Now, as a nursing staff also, I told you, the older people try to confine what is the domestic issues happening with them, with you more, because you are more closer to them than the clinicians. So you must know what elder abuse means. So either there are 5 types of elder abuse: patient is being hit physically, psychologically, or emotional abuse, that the person is given, like their family members threaten him or tell him not to go outside, not to meet your friends. Okay, and sexual abuse is very less common in older people, but if they have abnormal bleeding from the anal canal or vagina, suspect that she has been abused. Financial exploitation is very common in the older people, so that's why in most of the hospitals they do that. When a patient is admitted, they ensure that all the ornaments and all are given to their respective relatives and sent, because tomorrow they will start blaming that when the old lady was come to our hospital, she had a golden chain, now it is not there. They will start blaming the hospital staff. So ensure that this should not happen from the nursing point of view. And older people are also financial exploited by their own children, that one must know. And neglect, as I told you, most of the older people, they don't get food on time. Okay, so that is again the neglect. Medicines, regular medicines, they don't get. So by these ways they are neglected in the home as well as when they are admitted in the hospital. Now the last aspect of the care is caregiver. You must know who is the caregiver in the history itself, whether it's the son, son-in-law, daughter, daughter-in-law, who is providing the care. Okay, and know the history from them also, because I told you the history is from 3 people: one from the patient, from the caregiver, one in the absence. So I try to also know from the caregivers. They will also tell you that this patient who was early active, now he doesn't want to even move around. Maybe the patient is having angina. So you can be contributing a lot of positive history from the caregivers. Okay, identify burnout. The caregiver will be burned out because it is a 24/7 for them, the family, to take care of an old lady or old man in the home. So try to know whether they have a physical and emotional and mental exhaustion, so that you can help them by providing a respite care. It is a role of nurses also, that you can tell the lady, the daughter-in-law, that you can go to for sleep for 2 hours. I will be here. I will take care of your mother-in-law or a mother or father-in-law, so that you can go and relax and come back after 2 or 4 hours. So that also, the respite is good for the patient and the patient caregiver. Okay. Now, when you provide a care for the older person, you must always ask the older person, shall I do this for you? Is it okay with you? Without asking, don't just go on enforcing what all have been known to you or you have been doing. Okay, now suppose the patient is just lying at 8 o'clock in the morning and you go to change the linen. Ask him, shall I change the linen now? Otherwise, just don't go and tell, now get up from bed, I have to change the linen, and because that is not the geriatric care. Okay, and do not argue. Always try to avoid argument with the older people, because they have their own set of ideas, and try to ignore. If you are not happy with certain others, just ignore, but don't argue with them. Do not react. If the old man is telling you something and if you are not happy, do not react, just respond. Okay, so you cannot go on telling that these are the hospital rules, I have to do this at this time. No, in the older care, we cannot enforce our rules for them. We have to be little flexible. I'm not telling that you should not do. You must do, but with a flexibility. It may be a 1 hour. Suppose somebody writes blood pressure checkup every second hourly, and he is sleeping in the midnight, 12 o'clock, and you woke up, now get up, I have to record your blood pressure. So those things can be flexible, because for him, sleep is also important. And no to ageism. Any older person admitted under your care, always try to be a part of solutions. Never deny the best of the treatment. Never say that you are 80 years old, 90 years old, why you want to get all these things done. Never say that, because every human being has a right to live as long as they have been given that period of to live. Okay, and always respect patient decisions. If patient is telling it's okay, I don't want the injection now, come back after half an hour, you say just okay, we'll come back after half an hour. That's the issue. Okay, like the small things are there. We have to respect the patient decision also. Sometimes patient says that I want to go home for 2 days and come back, I'm not feeling well here. Okay, you have to talk to your seniors and consultant, and you can take a call on that. Okay, so in a nutshell, there are so many issues a nursing staff has to address in an older care. So there has to be a holistic care, and of course it's a teamwork. You alone cannot provide all these things. So holistic approach, what are the challenges you come across? You come across the constraints. Maybe the patient's caregivers are not good, or they're not cooperative, and he may be abused by their own family members. Spiritual close, psychological aspects of the older persons you don't know immediately because it's just 2 or 3 days. Maybe a patient is there for 1 week. You will try to know him in the better person, or if he's admitted multiple times, you'll be knowing him better. So psychological issues, spiritual issues, comorbidities. A patient will be having 3 or more. Some patients are having 8 to 9 diseases when given to them. So this is a challenge for not only for clinicians, for also the nurses. So again, acute on chronic disease. The patient will be having a lot of chronic diseases, but one acute pneumonia adds to the heart failure, existing heart failure. So that enhances all the symptoms to the larger extent and makes the person bedridden or the chair-ridden. These are all challenging we have to come across. So when providing the care, you should apply ethical issues. Sorry. You should respect the person's decisions, do no harm, always do what is beneficial for the patient. So to conclude, the take-home message, to provide a health care for the older person is the biggest challenge. It needs a teamwork. That is what this program is doing, to create a team and which are sensitized to the geriatric care. The older people are very smart. They will judge you at the first sight because they have seen n number of doctors, n number of nurses, had admitted in n number of hospitals before they come to you. Have patience. This is very, very important in geriatric care. You have to have patience, you have to have compassion and empathy. So if these 3 features are in you, then you will be very good. And the most important is you will get that happiness and the professional satisfaction. Okay, so you should have a compassion, you should have empathy and have patience. And the best communication is to listen. To listen. If you do these 4 things in every patient comes to you, you will be more satisfied than anything else. Always try to provide a dignity in death, and please, I request all of you not to practice ageism. So doing what has to be done and not expecting anything in return. This is a part of our medical profession. So you are also the part of this. So I wish you all the best. And I just end with this talk with saying of quote by James: you do not heal old age, you promote it, protect it, and you extend it. Thank you very much for your patience hearing. Wish you all the best. Thank you.